So welcome back, everybody. We are very, very pleased and honored to have as our keynote for today's conference a collaborator and great friend, Lisa Eckenwiler. Lisa is an associate professor in the Department of Philosophy and the Department of Health Administration and Policy at George Mason University. So she's coming from Washington, D.C. right now, so a little bit of a respite for her from things going on down there. You know, Elizabeth, my wife, flew to Washington yesterday because the idiot North American Society for British Historians thought that having a conference in Washington, D.C. the day after a presidential election was a good idea. Yeah, so there you go. You probably crossed in midair. You were coming in the... Oh, well... Oof, okay, so enough said. So she teaches primarily courses in bioethics, public health ethics, global health ethics, and her research focuses on justice and health, a range of issues in humanitarian health and research ethics, and on the exploration of the significance of place for promoting health justice. Her books include Long-Term Care, Globalization and Justice, which came out in 2012 from the Johns Hopkins University Press, The Ethics of Bioethics, Mapping the Moral Landscape, which is an edited collection, which also came out of Johns Hopkins in 2007. She's been a fellow at the Center for American Progress in Washington and the Centre de Recherche en Éthique de l'Université de Montréal, a center which I've heard of, there was this guy, she serves on the advisory board for the International Network of Feminist Approaches to Bioethics, as well as the editorial boards of Bioethics, Developing World Bioethics, and Public Health Ethics. And she's going to be speaking to us today on a relational model of responsibility for research in humanitarian settings. Please join me in welcoming Lisa Eckenwiler. Oh, it really is the plane.
Yeah, it really is. It really is the plane. Yeah. It's okay. You just stash it over there. Good morning, everyone, and I hope I'm getting this right. Merci d'être venu. Okay. It's been il y a trop longtemps since I've been in Montreal. 2 years, I think, exactly. And I just want to begin by saying thanks to Daniel and Teresa and Gabriella, with whom I've been corresponding mostly around this event, for inviting me. And I also really want to say thank you for inviting me, as we've been joking about for the last couple of minutes, so soon after the events of November 8th, 2016, which is how I will forevermore refer to Election Day this year. So I also have a lot of thanks to owe to some people who are in this room and in this city and in other Canadian provinces. Because the work that I'm going to present to you today is in no small part due to some of the collaborations that I've had with Matthew Hunt, Rioa Chung, who I don't think is here at the moment. Oh, where is she? Oh, voila! Is that it? Perfect, perfect. And also Renaud. So I'm really, really grateful for those collaborations for all kinds of reasons, but also because it's helped support the work that I'm trying to do here. So let me just say just a little bit about the background here. A couple of years ago, I started thinking about trying to reconceive and reconfigure the model for engagement around ethical issues in research. And I've been talking about that in terms of what I'm calling the social connection model of responsibility for research. So that project has been sort of lying fallow for just a little bit. And in the last couple of years, I've been doing some work largely led by Matthew on research in humanitarian settings, research ethics. And so what I want to do today is try to fuse those two projects, because it seems to me that they go very well together. And I also want to tip my hat to Renaud. Our work is so tremendously complementary, and I'm hoping that you'll see the connections between it with this talk. So just to start off a little bit, to talk about some of the characteristics that describe research in humanitarian settings, some things that are probably familiar to all of you. But so these are projects that have to roll out really quickly. They're very often unpredictable, sometimes chaotic conditions in the field. When you're thinking about potential participants, this is true in any sort of humanitarian context, and I find myself lately thinking a lot about research involving refugees. So you're dealing with people who've been, for whatever reason, uprooted, displaced, very likely dispersed, and traumatized. people are already, they're vulnerable. That's just a given when you're thinking about crisis-affected populations. But of course, it's also true that if there's a crisis, that there be pre-existing vulnerabilities that are being exacerbated in the context of a crisis, and really variable vulnerabilities confronting different groups with which researchers may have to contend. Also, stating the obvious, all of the speakers referred to the fact that there are these really tremendous asymmetries in power between researchers and potential participants. Not just because somebody's been dealing with a crisis and other people have not and have arrived to do research related to it, but also just people from high-income countries and low-income countries or middle-income countries. There's also the problem of what we think about in a clinical research context, the therapeutic misconception. So in a humanitarian setting, there's the problem very often that people may think that research is somehow related to aid, right, as opposed to just being committed to developing generalizable knowledge. So there may be some confusion about what it is that people are signing up for if they agree to participate in research. And then the last point, multiple actors with intersecting responsibilities. And I don't think we can overstate this too much. So right here, what I'm thinking about are multiple research ethics committees who may be involved in reviewing a particular project, members of the research team, and then, of course, you also have aid organizations, governments, and other political officials, and local health workers, all of whom may be interacting in the field with different and sometimes overlapping responsibilities. So what are the existing mechanisms that we have? So as you all know, we have research ethics committees, or what we call in the States institutional review boards, IRBs. And as I just suggested in the last point, these can be really complex, right? There could be multiple RECs reviewing a given project. Then there's also consent. So we get consent from individuals. What's presupposed, but not very often specifically addressed, is investigator capacity. Renaud spent a few minutes talking about the importance of preparation. There's not very much said about it explicitly. We just sort of, I think, take it for granted in this context. My worries about this are several. The first is that these processes, that is research ethics review and the consent process, are typically event-oriented. They're one-time kinds of activities for the most part. Moreover, and there's some research to suggest this, including Renaud's, these processes are very often by researchers perceived as hurdles or hoops to jump, hurdles to jump over, hoops to jump through, right, or boxes to check, and then you move on, right? You're done with your ethics. Moreover, there's the fact that review is always prospective, it's always speculative. You're trying to anticipate what issues you're going to confront in the field when you don't really know, no matter how much research you do. To prepare yourself, and as we have some reason to believe, it's not clear that sufficient research goes into the effort already. But it's also very often detached from the field, thinking about research ethics review, and maybe even the country. So research ethics committees in high-income countries reviewing projects that are going to go on in disaster settings in low-income countries. The review is also highly variable, so you have multiple IRBs reviewing a given project. Some may see no ethical problems, others may see multiple ones. So this inconsistency is a problem that researchers have to contend with. And then last, there's this underlying conception of potential participants and also principal investigators. And there's a lot more work that needs to go on here, but I think what I'm particularly interested in here is this idea that we presume that people are vulnerable when we're doing research in the global context, but particularly when we're doing humanitarian settings. And I think that's right. We should understand people as being vulnerable. But I also wonder to what extent that conception may constrain us from other ways we might think about potential participants and other ways we might think about the relationship between principal investigators and research participants. So moving toward where I want to go, it seems to me that in the system that we have so far, there's a lot of unrealized potential. And it's unrealized potential in a lot of different domains, all of which have to do with relationships that characterize the research process. So there are relationships between researchers and participants, especially crisis-affected ones. There are relationships between researchers and research ethics committees, relationships between research ethics committees, relationships between researchers, research ethics committees, and other people who may have connections to particular protocols. So local health workers, for example. And then last, the relationship between the research enterprise in a humanitarian context and the social and political determinants of crisis. So what I would like to argue, not yet. So it's not like nobody's thought about this. Renaud showed you a much more rich slide in terms of all the different guidance that you might draw upon if you're a researcher working in these kinds of settings. One particularly recent one is this project done by Curry and Arthur Kaplan and who's the other person, Waldman, somebody, forgive me, I hope you're not in the room, Professor Waldman. An ethical framework for the development and review of health research proposals involving humanitarian context. But again, this work, so far as I can tell, presupposes existing structures and processes around research ethics. So what I would like to argue is what I'm going to call a relational model of responsibility in research. What I mean by that is that all agents who contribute through their actions and their practices to the processes that constitute the conduct of research projects have responsibilities. So I'm adapting this from work done by a philosopher named Iris Marion Young, who has done work on conceptions of global justice. And what she argues, and here's a quote, is that all agents who contribute by their actions to the structural processes that produce injustice have responsibilities to work to remedy those injustices. So I want to say something similar for the research context. There are really two defining features of what I want to try to propose here. The first is that responsibility ought to be dispersed among multiple interdependent actors who are situated throughout the research process and the specific setting. So I'll talk about that in terms of thinking ecologically. And then second, this research should be responsive to participants' experiences of displacement and trauma, and to what my colleague Rioa Chung and Matthew Hunt have called structured health vulnerabilities that are attributable to structural injustice. So I'm calling that an ethic of responsiveness. So broadly, what I want to try to do is see research as a social relational endeavor and as an activity that's embedded in social and institutional relationships. And I think what this ultimately can help us do is reconceive the nature of these relationships themselves. So the first element, thinking ecologically. So two elements here. First, this idea that there is connection or interdependence among domains and actors. So think about all of the people who are involved in a research process, from funders to people on the ground who may be carrying out aspects of particular protocols, to the people who are helping to publish and disseminate the results. So rather than thinking about these as distinct spheres, I want to suggest that they are inevitably interdependent, and we need to think about the research ethics process as an interdependent, interconnected endeavor among all of these different domains and actors working within them. The second element comes from feminist epistemology. Anybody who's had a good feminist ethics class knows that the way to think about how knowledge is generated is to think about it as being situated. So we are all knowers, people with capacities to think and know things, and we're located in particular settings. So we're located in a couple of ways. We can be geographically situated, like where we are spatially, and then we're socially situated, so in terms of gender, race, ethnicity, socioeconomic status, in that sense. So all knowledge is situated and therefore inevitably partial. Lorraine Code is a philosopher who's done some work, sort of following the thinking of Rachel Carson, an ecologist whose work you may be familiar with. And Code argues for an ecological analysis and says that it's one that situates knowledge generation in particular places, populated by particular people, and conceived as intersecting with other locations and their occupants. So what I want to try to do is create, or argue that we should create, what Margaret Walker calls different moral spaces wherein ethical engagement can occur. throughout the research process. And what I think that this can do is help us to try to stitch together fragmented, dispersed actors or moral agents in their fragmented, dispersed domains, and try to weave together a more integrated fabric of understanding about what is at stake ethically and what a fitting response looks like. I think, in other words, we shouldn't just leave this to RECs and investigators. So within research projects, right, we might be thinking about people other than research ethics committee members, other than principal investigator, and even other than the research staff as having the potential to trigger questions about the ethical issues at stake in research. Another line of argument that's just come out from work done by MSF, or Médecins Sans Frontières, around research ethics in the context of Ebola, speaking to this issue of multiple IRBs or research ethics committees reviewing particular protocols, they argued that one of the problems that they faced was that there was very little communication, if any, among IRBs, so that they argue that there ought to be transparent communication among research ethics committees on a given protocol. So that's one example of the kind of thing I'm arguing for that they're calling for as a result of their experiences. And then in terms of research projects that are going on separately, some of the interesting findings coming out of Renault's work are that researchers find themselves suffering from what somebody, I don't know if it's you, calls assessment fatigue. So they get to a place and they're trying to figure out what the heck is going on the ground. And it's exhausting because you're in the middle of a crisis, again, with multiple actors, with multiple jurisdictions of responsibility. So the whole thing is really overwhelming. And however focused you may be with your particular project, there can be this kind of assessment fatigue when you're in the field. And maybe there's another, the question mark is to suggest that I'm open to lots of other ideas for what connections among research projects might look like and how that might be helpful to ethics assessment. The next piece of a relational model of responsibility is what I want to call an ethic of responsiveness. Now, you're going to have to forgive me because I understand there's some literature out in the world now on responsiveness. I only know some of it, and I don't know nearly enough of it. So this is just Eckenwiler's take on responsiveness, and with the need to go and see what kinds of things other people are arguing. But it's an ethical concept I find myself really drawn toward more and more, one that I think demands more attention. So 3 pieces of this. First, affirmation of humanity and solidarity. Second, a relational conception of justice aimed at responding to structured health vulnerabilities, that is to say, health inequities. And then last, ongoing ethical attention, especially to vulnerabilities and the way that those continue to evolve and shift in the field. The first point, I think, is really a point about the ethical identity of the researcher and a point about the researcher's relationship with the participant and the potential of this relationship that I think is really untapped. The second point, I think, is really a point about responsibilities for justice that researchers have as individuals and that we have as people involved in the research enterprise writ large. And then the last point is really a point about the moral capacities of everybody in and around the research endeavor. So affirmation of humanity and solidarity. In some earlier work that Matthew Hunt and his colleagues have done, they argue for what they call an ethics of engaged presence, and saying that this is an important framework that people working in humanitarian assistance and development work can draw upon. And I find a lot of traction in this. So I want to include that as my first piece under affirmation of humanity and solidarity. Because what this ethics of engaged presence does, first and foremost, is call for recognition of the shared humanity of people in need. And it isn't shared humanity in just the abstract. It's shared humanity against a backdrop of global health inequities. Which leads us to the next point about solidarity, which has been defined in all kinds of ways, and there's a really terrific literature that's been emerging around solidarity. But in short, what I want to say is that it involves standing with others who are vulnerable, especially in resisting injustice and calling for justice. And it seems to me that in this particular context, this is really important for researchers for the sake of avoiding exploitation. Now, this is probably the most philosophical slide I'm going to throw at you, but I'm drawing upon the work of my current favorite philosopher, Rosi Braidotti, who talks about cosmopolitanism, right? This idea about, just to state it in the simplest lay terms, thinking about ourselves as citizens of the world and having obligations for justice for the world. So she argues that cosmopolitanism needs to become world in the sense of developing a radical relational model of interaction. Now, she's also interested in what she calls eco-others. So, non-humans with whom we have interactions and with whom we are inevitably related. But let's put the eco-others aside for this, and let's just think about structural interconnections among people around the world. And I want to say that this is part of what, and I'll say more about this in the next slide, but what researchers need to be thinking about is themselves, not as separate from potential participants, but as inextricably linked with them, as humans against a backdrop of global health inequities. What Braidotti argues is that the heart of this political project lays in ethics that respects vulnerability, but reworks it affirmatively, while actively constructing social infrastructures of generosity and hope. This new ethic, she argues, is based on the notion of propelling ontological empowerment, or the empowerment of our being. A new entity thus comes into being, out of injury and pain, by actively constructing energy and transforming the negative charge of these experiences. So I want to say that there might be some interesting traction here in ways that we could rethink the relationship between researchers and participants, particularly in settings where people have faced trauma and displacement. So research in any kind of humanitarian setting, but particularly, not particularly, but lately I've been thinking a lot about research involving refugees. And it seems to me we want to respect people's vulnerability, but part of what we also want to do is think about affirming them not just as our fellow humans, but affirming generosity and hope. And it seems to me that if research is about anything, it's about that. The second element of an ethic of responsiveness, relational justice and structured health vulnerabilities. So this gets a little complicated philosophically, but the idea here, structured health vulnerabilities emerge in part as a result of structural injustice. So, in other words, when we're thinking about responding to vulnerabilities, we have to think about the social, political, and economic determinants of those vulnerabilities. And in a piece by Rioa Chung and Matthew Hunt, they argue that disaster assistance, so not research, but assistance, ought to focus not just on acute needs, but also the social political determinants of vulnerability that shape needs now and in the long term. So what I want to argue here is that research in humanitarian settings should be responsive to structured health vulnerabilities. I feel like I'm really out on a limb with this line of argument, so help me. In designing and carrying out projects, so projects, maybe not each particular one, but programs, I want to say, of research should build in a mechanism that enables us to think about not just improving urgent assistance, but also on promoting future health equity. And indeed, Chung argues, or she describes as apolitical, any view of medical humanitarianism that does not engage in the analysis of the social political causes of pre-existing and future health vulnerabilities. So, in other words, we have to come at this with the social determinants of health approach in order to be responsible. And part of this also involves discerning what is the relationship between the international humanitarian community, including researchers, and certain forms of health vulnerability. Right? And so we want to think about the ways in which our work as researchers, I mean, I'm not a researcher like empirically, but the ways in which the work of research may perpetuate those inequities over time. So we need to build in a mechanism that ensures we're not just figuring out how to do better with acute response, but we want to do better to try to promote equity long term in the research enterprise. The last bit. So here I'm really drawing on some philosophical literature around responsiveness. And what I want to argue drawing on the work of Elise Springer, is that a relational model of responsibility calls for extending a temporarily continuous thread of attention. So you're not done when the Research Ethics Committee is met and you've got your letter of approval. You're not done once you've gotten consent, but rather this is a process of ethical engagement throughout the life cycle of a project. And what you're attentive to, what you're responsive to, are the possibilities for abuse that arise with vulnerability. So I'm fusing what Elise Springer has argued and the work of Joan Toronto in her work about an ethic of care. So I want to say that to really be responsive, we have to have the participation of people dispersed throughout the research process, including people in the field, not just Research Ethics Committee members, and not just people getting consent from participants. And some of this draws on earlier work that I've done with Matthew Renaud, John Pringle, on responsiveness for research ethics in low-resource disaster settings. So this is drawing on some of that as well. So what kinds of things might we be attentive to over time? So I'm looking at an article that Ezekiel Emanuel and colleagues made about what makes clinical research ethical. So here are the kinds of things I think that people other than Research Ethics Committee members and PIs can contribute to thinking about. What does it mean to show respect for participants and communities? What is social value? Validity even. Fair selection of participants, right? That might look like one thing in a Research Ethics Committee and something very different in the field. What is a favorable risk-benefit ratio? And what is independent review? Then getting more close to the kind of research that we're talking about. Curry, again, this piece about an ethical framework for the development and review of research in humanitarian contexts. So they talk about raising questions around what are the relevant analyses of harm-benefit ratios, recognizing that there may be more than one analysis available. What is the relative importance or priority that this protocol should enjoy in the larger context of evidence building for humanitarian response? How the research benefit the community and the individuals involved? Again, I think people dispersed throughout the process may have things to say about this that are useful. MSF also has a research ethics framework that raises some very interesting questions. What are the potential wider social harms and benefits to communities? Again, I'm not sure Research Ethics Committee members in high-income countries are particularly well-suited to understand that. How are harms and benefits distributed between participants and communities? What's the process to monitor unknown harms or new information arising from the study? So they speak specifically to this need for ongoing ethical attention. But there's no way that that's really operationalized currently. So in all of these ways, I think people situated in different places along the research, throughout the research process, and people who are situated differently socially can generate different answers to these sorts of questions. And that ought to go into ethics assessment. Now, if you ask me exactly how to operationalize that, I'm probably going to start waving my arms and feel really nervous because that's not what I'm really good at. I'm just saying that this is what we ought to aspire to. And we'll get the policy wonky people to figure out how to build it. So parameters of responsibility, right? So who has responsibility to do what? Again, drawing on Iris Marion Young, I think we can think about assigning responsibilities on the basis of your scope of power, on the basis of the resources that you have available to you, and also your ability as an individual and your collective ability as a member maybe of multiple networks. But all stakeholders, and there may be a longer list, but at least funders, at least research team members in and out of the field, Research Ethics Committee members, elected officials, participants, maybe other people, have capacities to contribute. So as, again, Iris Young argues, we dwell together within a set of problems and relations of structural interdependence. So researchers and their colleagues dwell together. Researchers, people in need of humanitarian assistance, dwell together. All of us dwell together. We'll find out just how much after President Trump takes office. So, last, just summing it up, all agents who contribute through their actions and practices to the processes that constitute the conduct of particular research projects, I want to say, have responsibilities. 2 main points. Think ecologically, distribute responsibility among multiple interdependent actors situated throughout the research process and the specific setting, and be responsive, both in real time and over time, to participants' humanity and specific experiences, and also, for the sake of global justice over time, structured health vulnerabilities. Thank you very much. And I didn't even go over time.
Oh, you're so good. Thank you so much for stimulating.
I'm not going anywhere.
Okay, so you're staying for.
Do you want me to stay?
No, you're staying right here. Okay, so open for questions. Oh, Daniel, first one.
Oh, no.
Okay, Daniel.
So I'm going to be really, really, I don't want to do this because we're friends and I'm going to do the thing that you said you wouldn't want to do. But I'm going to ask you in a slightly different way. I'm not going to ask you how we can operate with this, but whether it's even, so let's take one of the ideas that I think is terribly important, and I mean, all of these are terribly important, the idea of responsiveness, right? The idea of responsiveness suggests that, well, that you respond, and what you respond to is often unpredictability. What you respond is, going back to the very first slide, the messy reality that is messy in ways, some of which you probably did sort of envisage, but others which you probably didn't. Clearly that's part of the ethical responsibility of the researcher to respond to the things that she or he finds in the field when they get there. And these are things that may not have been sort of present in, say, in institutional ethics or sort of clearances. And indeed, in some situations, and I think some of the, this is sort of building a bridge towards some of the case studies, the sort of general, some of these ethical goals may actually conflict sometimes, right? So you may actually have to slightly violate certain sort of deontological constraints in order to achieve consequentialist good, where, the more sort of standardized R&D. So I'm not asking you how to do it. I'm asking you to say whether the sort of forms that we have developed in order to sort of conduct ethical research are appropriate to the task. Just a little question.
A little question.
Just a little question. Well, that's exactly where I start launching off of this. That it seems to me we've got this kind of administrative liberal individualism, right, that governs the whole thing. And ultimately, I think it isn't well suited, really probably for any research. But I think it's particularly ill-suited here when you're dealing with people who have, multiple intersecting, continually evolving vulnerabilities, but who also have capacity to be sort of agents of change despite that vulnerability. So yeah, it's ill-fitting, but what else do you want to say? I mean, I think it is, right? And I think that part of this has to do with more education and training for everybody who's involved, right? Not just people who are going to be in the field doing it. I think it means creating new kinds of social forms, so thinking about what Margaret Walker, how do you concretize this idea of creating moral space? What does that look like outside of, this is where we're going to meet at this time, and here are the 10 protocols we're going to look at. What does that look like in a more informal sort of way? So, at the end of the day, I think what we need is more ethics education and training, but of a different kind. One that enables people to be a little bit more nimble and, I'm going to use the word responsive, in their moral engagement rather than rule following and box checking. Mm-hmm. Mm-hmm. I don't know if that helps at all.
Yeah. Sam and then Beatrice, and then... Mm-hmm.
Then how does one reconcile power and ethics?
Okay, thank you.
So in other words, this is very idealistic, and we could figure out an operating system to use it. It would be marvelous. But my question is, do we have a map to outline how we put all of these pieces together?
I don't have a map, but I think we could build one. I mean, this is the point about, parameters of responsibility. So scope of power, resources, and ability, right? So you could probably map the research enterprise, right? And think about who's responsible for what and how that relates to other people who are responsible for particular things, right? And figure out, what are intersecting responsibilities, what are distinct responsibilities assigned or that are tied to particular roles. So I think you could map it. I think you could.
Well, I'd like to see it.
Yeah.
Right,
There's a challenge.
So some of my earlier work was on care worker migration, right? So you can map, for example, who's going from Mexico to the United States to work in long-term care, or who's going from Bulgaria to Italy to work in long-term care, that kind of thing, right? And so I think there's that kind of mapping, right? So I think that you can map relationships in all kinds of ways, right? So I think that you can map, for example, relationships between government officials in source countries and destination countries from which care workers migrate. I think you can map relationships between families, right? It's really complicated. And I'm just giving you another example, not in a research context, but I think you can map, let's say, relationships between me and the children of the woman who's taking care of my grandmother in a long-term care setting. I think you can do that, right? And I think then you can assign people responsibility based on their connection to the other people, their scope of power, their resources, and so on. So do I have as much power as a government official? No, right? But I do have power as an individual to do certain things. And I think that as in research ethics context, we could say the same sort of thing. So I think it'd be really messy, really complicated, but I think you could do it for particular projects, and maybe that's what we should aspire to. Who are the stakeholders, and who ought to do what, at what points? And maybe they don't do anything, maybe there's not a need, but there could be that infrastructure in place.
Beatrice, just to continue the conversation.
Cut me off.
Beatrice?
That's a really good question, and I'm not interested in people being friends. I'm not interested in people being counselors. I'm interested. Yeah. No, I think this is the point about affirmation of humanity and solidarity. It's you're my fellow human, and you have suffered, and you are still suffering. And I think that that's part of what researchers have the potential to do in this context. It isn't just I'm here to study you how to make things better, but that kind of, as Matthew puts it, engaged presence. So I think it's more than I'm here to use you in my study. And I think this should happen in all research, frankly, but I think particularly here, it's essential. Otherwise, I think we're just instantly in exploitation and treating people merely as means and as tools. So I think it's that acknowledgement not just of humanity, but acknowledgement of suffering and of relationship to that suffering. Even if it's just as your fellow human, I'm related to you, but also if I'm from a high-income country and you're from a low-income country, I'm probably related to you also in political and economic ways. And I think that's something that researchers need to reckon with.
Okay, one last question before we have our introduction to the vignettes for this afternoon before lunch. Yes. Could you stand up, please, maybe so we can hear you?
Vulnerable? Yeah, so there's some interesting work that's gone on, and I'm interested in doing some more of it myself, to be honest, about what the concept of vulnerability does, like how much work it does for us in the service of promoting justice and the ways in which it may actually undermine it. So the idea is not to say that people aren't vulnerable, but to say that if we only think of them as vulnerable, a couple of things happen, or might happen. We perpetuate distance, like the othering of people, so that happens. And we can also be vulnerable to denying people moral agency, right? If we think you're so traumatized, you don't have the potential to contribute anything other than as it being a data point for me. And I think, back to the ideas that other people have talked about, community engagement or research participants as collaborators, that sort of thing. I think we need to take those ideas much more seriously. And so I'm not saying we ignore vulnerability. I think it's been a valuable concept to help us think about the needs of specific groups whose needs may be different from like those of the broader, more general population. So women, people of color, the disabled, and so on. But I think we can perpetuate victimization. And there's been a lot of writing on this. I think Didier Fassin is one person, and I'm not sure who else has published on this. But it's one of the things that people who work in humanitarian assistance are I'm going to use the term, vulnerable to. Right? In thinking about other people as vulnerable, they can perpetuate that kind of victimization and disempowerment. So that's what I meant. Does that help?
Okay, great. Thank you so much, Lisa.
Oh, thank you very
Daniel?
much. Thank you.
Daniel will just wrap up the conversation.
So, well, thank you very much, Lisa. That was fantastic, and I think it really sort of sets the table extremely well for what is going to come now, which is a presentation of the vignettes about which we'll be talking over lunch as we look at the posters that set them up, and also this afternoon when we try to discuss them. And I think that some of the themes that emerge from the talk are. The importance of viewing our relationships with research subjects as relationships with people who are agents, who cannot be reduced, especially in the context of global health. Somebody asked this morning, and I almost jumped, why do we use the term global health rather than health, which was a question that had never really occurred to me, but it struck me that global health is used in in our countries as a euphemism for rich people doing research on poor people. And it's a nicer way of saying it, but it is always the constant risk of othering people through empathy, othering people for all the sort of for motives that are not awful, but nonetheless reducing their agency, and in some ways also reducing our own agency, which is much more sort of spurred when we're reacting to people that we conceive of as agents rather than as things about which we can sort of preconceptualize and put into boxes. So I think it makes the ethical challenges, and I think again a theme that Lisa came onto again and again and again, not just of research in global health, but really research, right? The temptation to simplify things by othering other people and by simplifying our own task through this othering is something that we should resist, but it's also something that makes the ethics of the whole thing much more complicated. And I think the table is beautifully set by all three of the talks that we've heard this morning, really. And so I guess at this point, we invite, do you want to do that, Teresa?
I do.
So Teresa's going to set up the vignettes.
The vignettes. So.
And thank you again, Lisa.
Thank you, Lisa. Okay, so now this is the fun part. We've challenged our four. That was fun. The whole day is just fun. So we've challenged. We had a number of abstracts. We selected 4 to be presented as vignettes in this afternoon session. But we're giving each of the 4 speakers, each of the 4 vignette people, 2 minutes to grab your attention so that during lunch you can go to their poster and speak to them to get a little more information about their vignettes, because when we come back in the afternoon, It's going to be 10 minutes for each vignette and then discussion about their vignette. So if you can get a head start with the conversation with each of these 4 people, there are 4 other posters there as well. So we want you to have a very interactive type of lunch. Okay? I'm going to call on Mark to give us his 2-minute spiel.
I'm going to take 2 seconds. I went to South Africa and I talked to people in bars about drinking and driving.
I think we can relate to that in Montreal. We can't wait to hear about the ethical challenges you experienced. Okay. Adoro, you have 2 minutes. You have 3 minutes.
Well, I had that to follow, but I'm glad Professor Weisok spoke about the othering of people we are doing research for. But interestingly, my vignette is about a situation where that othering was actually done, was intrinsic to the population in which the study was being conducted. And actually, so it was a case basically of people who saw themselves as so different from the people who wanted to do research on them that they felt almost like guinea pigs, almost. And so that's about everything. Okay. I'm keeping everything at the wraps.
Great, Adoro. And now, Jerry? Oh, Anne-Marie wants to go first? Anne-Marie. Anne-Marie. Oh, I see we didn't balance the gender for these 4 vignettes. Anyway, never mind. Anne-Marie.
Yes. Hi. I'm a PhD student in public health at University of Montreal, and today I'm going to be talking about one of the major ethical challenges that I encountered during my PhD, and that is the challenge of protecting the participants' confidentiality at an individual level, but also at a group level, while collaborating with local stakeholders in the context of a global health research. So I identified some factors that make it more likely that participants can be identified during the restitution and the dissemination of results to local stakeholders. For example, during my PhD, I found that sometimes it was difficult to disseminate the results because the decision makers knew exactly where I had collected the data, so they knew which healthcare centers I had visited. Another factor was that some of the participants had very unique roles that made them more easily identifiable later on during the dissemination of the research. And also, because I was doing a process evaluation, I needed to spend a lot of time in each healthcare center. And so, of course, as a doctoral student with limited resources, this reduced the number of healthcare centers that I was able to visit. So in the end, it is a limited sample of healthcare centers. And so because of that, I found that when I disseminated the results later on, I was a little bit worried about whether or not the local stakeholders would be able to identify the participants that participated in the study. So that's what I'm going to be talking about, and I also identified a list of potential strategies that could be used by researchers in order to face this challenge. Thank you.
Okay, perfect. And, pardon me? Oh, last but not least, before lunch, has lunch arrived?
Yes.
Perfect. Last but not least, technical issue, because we have an audiovisual. Jerry wants to capture our visual imagination in explaining his vignette. Perhaps you could start with the explanation, Jerry.
Okay, well, let me just this is great. The issue that I'm dealing with, I was working with some students. I'm a prof at University of British Columbia, and I knew I was going to be heading back from South Africa, luckily, safely, from people who were driving, and being in Montreal and working with some students to develop a project that was transformed into a poster. So what it's dealing with is a research program, research projects that we're involved with in Ecuador, where there's a community, if we can have this, that has been dealing with problems of pesticide contamination. And our colleagues that we're working with had found that they were quite concerned, this community was quite concerned about contamination of breast milk for young mothers and their infants and families. So one project that was being considered and suggested was dealing with problems of contamination of breast milk, but we were really looking at the questions of what are the ethical concerns in doing that. You don't want to express that, don't want to feed back word that there's contaminated breast milk if that's going to discourage breastfeeding, which is so beneficial. At the other hand, there's a serious concern, and one of the questions that was coming up, since we were engaged with the local municipality to be building alternatives for a child care program, linking agroecological producers to the child care, I guess we would call them, program that the municipality, and it's a largely indigenous municipality, was providing, and saying, well, are there ways that we could look at this challenge of breast milk contamination to looking at the motivations for building alternatives? And what fundamentally is a challenge is it ethical, perhaps narrowly, to just look at a problem that doesn't engage a population that's affected by that, not engaging them in building alternatives. And as our contribution from the Canadian side, with Canadian students involved, we thought it would be useful to be looking at the literature that deals with how community engagement with issues of contamination are dealt with. And in fact, we're going to be sharing some of these outcomes with a meeting with these communities in 2 weeks in Ecuador, as the protocol for how research will be conducted will be carried on.
Great. Thanks for stopping by Montreal, Jerry. I'm sorry for the technological difficulties. We will try and fix this during lunch. But we will now thank our 4 vignette speakers. And so there are the posters, the vignette speakers, and lunch. See you back here at 2 o'clock on the dot. Thank you, everybody.